Hello, all you folks, and today I would like to answer a question I've been asked oftentimes in my work as a therapist in a rehabilitation center. We often receive patients who come in with their families, and because of this or the other reason, they ask to be treated on an outpatient basis when in fact we as the therapists are saying you will benefit more from an inpatient basis. And this elicits discussion all the time. They ask, why can I not just have an outpatient? And today, so I'll answer this question. What is the difference between inpatient rehabilitation and outpatient rehabilitation? And when is which the best option for you? To start us off, I'll say this, that when someone is brought into a rehabilitation center, any rehabilitation center, for rehabilitation for abusing drugs, alcohol and drugs, or for being outrightly addicted to this, the first thing that is done is an assessment. A professional assessment is made of this patient, and this assessment highlights what the problem is, details it, and from the details obtained, it's possible then to know how far the problem has progressed and what needs to be done. In my center, we do a 3 or 4-way assessment for all incoming patients, whether they are going to be outpatient or inpatient. We assess their physical health. This is the same as when you visit your doctor, your GP. They will examine you, they will take your blood pressure, your temperature, your weight. They'll ask you if you're feeling any discomfort, any pain. They look for signs and symptoms of illness. They categorize them, and they may ask for tests, laboratory tests, radiological tests before they arrive at a diagnosis. That is one aspect of assessment. Then we do a mental status examination or mental status assessment. We would like to know how the functioning of your mental faculties is at that point of time, because we know a number of people who are affected by drugs of addiction as well as alcohol also suffer from mental health issues, commonly like depression, anxiety. Some of them may have psychosis. Some of them may be having suicidal ideation. Some of them may be having psychological conflicts within their mind emanating from their families or their place of work. And this may manifest as mental health problems. So we assess you for mental health status, and this is done with the aid of our psychiatrist. We then also do a general psychological assessment. We profile the functioning of your mind, the state of your mind, the normal mind, so that we know how is your psychological state. And this may reveal that you are balanced, you are okay, you think like a normal person, you do not have any stressors, or it may show that there are significant psychological issues affecting you, which may, if not dealt with, progress into something big. Then lastly, we do a global assessment where we look at all the things that I have mentioned, but we move to incorporate the social well-being, your religious well-being, your belief systems. Who are you and how do you function within the family, within the society? Are you someone who interacts like a normal person, or do you have anything that someone may point out? When we put all these aspects of assessment together, then we come up with a global outlook of how our patient is vis-a-vis the drug of choice. Of course, I've not mentioned that when we are doing the assessments, we'll have started by taking a detailed history of what drugs you use so that we incorporate it in the findings of our assessment. Having done the assessment, then we talk to your family and express our opinion that your loved one who you brought to us, we found him or her having a history of using these drugs. We see that the use has reached a stage, could be mild, moderate, or severe. And together with that, they may be having physical problems, medical problems, that is, which we will tell them, or psychological problems, or outright mental problems, or they have some social difficulties which help them not to function well within the society. Now, we discuss this with the family so that they get a view of what we are dealing with, but also that they can tell us how they would like us to proceed. And at the time we are telling them this, we mention to them that it is our view that this patient probably would benefit from this level of care. And this is where the question that I set out to answer when I began this video comes up. Will this patient benefit at the outpatient or the inpatient level? Normally, the family has an input, but we drive the decision so that we guide them professionally to make the right decision. Now, people who fit into the outpatient category, just to summarize, are usually people whose use of drugs of addiction is still mild or is tending towards moderate, but these people do not have many other accompanying problems: physical, medical health problems, mental health problems, social problems, psychological problems. So these are people who are experimenting with drugs, if we may say, but they have just gone astray, overdone it, and with a little intervention at an outpatient level, they can come back on track and function normally. On the other hand, the people who we recommend for inpatient care are usually people whose use is moderate to severe, and these are people who usually have other accompanying problems. Physical medical problems, they may have health problems, blood sugar problem, blood pressure problem, liver problem. They have injuries, probably they fell or they got into an accident. They may also be having mental health problems, depression, psychosis, anxiety. They may be having social problems. They are, if I may say, misfits or not fitting well in the family, so that they have estranged themselves. If they are married, they are separated, they are divorced. If they are not, then they have a level of disharmony with the family such that they are probably not staying together with the rest of the family. So from this, we know that the social support that they need to function well will be lacking, and then that makes that situation a bit of concern to us. Generally, these are people who we know that if we let them to go on the outpatient program, we'll be facing challenges whereby every time we attempt to move forward in treatment, something beyond our control happens to reverse. And this, for example, could be this person is severely addicted to alcohol, to drugs. They can't function. They start their day by taking alcohol or smoking weed, and they end the day by doing the same. So if they come into rehabilitation day one as outpatients, when they go out, they'll start smoking or drinking before they get home. Therefore, we need to cut them off from this scenario that has developed around them until they're strong enough to go back as new persons to be able to live a different life. So in a nutshell, those are the considerations then we make to make a determination if someone will require inpatient or outpatient program. But as I said, we make this decision in consultation with the family. We give the professional opinion, and the family, together with the patient, sometimes, if they are able to make a decision, because sometimes some of them are not able to make a rational decision, they then decide, and we make the best out of the decision that they have made. Once the decision has been made, then we make what we call a treatment plan, which then incorporates the aspects of care that they have chosen with the objectives that we'll have developed, so that we deliver the final product of care as the patient and their families would wish. I hope this, in a nutshell, will be able to answer the question that we've been asked all the time, why we choose outpatient or inpatient care. And just as an addendum, when we're having this discussion, sometimes some families say, oh, my family member, I would have liked inpatient, but you see, they're working, they're in school, they can't miss, and this will be a problem. And sometimes we tell them, yes, what you're saying is right, but I would like you to consider, we would like you to consider that if this person's usage, its level of addiction, and the problem surrounding it is severe, it means that this person cannot meaningfully benefit from schooling, from work, and so you would rather opt to have this patient come in as an inpatient, take a sick leave, and we can facilitate that by writing to the institution, to the school, to the employer, and this person is sick and in hospital, because rehabilitation is hospital just like any other hospital. And then this person, when they benefit from the treatment and they're strong enough, they're able to go back to school and to go back to work. We advise families that do not insist on your loved one going to school or going to work when in fact you can see that the level of addiction they're involved in, they cannot meaningfully benefit from schooling, from work. You'll be quoting a disaster, because they'll fail that exam, they may be expelled from school, they may lose their job, or they may do something that hurts them in some way that is irreversible. When in fact, if you had just taken a small pause to allow for treatment to happen for a short period of time, this person will heal sufficiently to go back to school, to go back to work, and recoup what they had lost, the time they had lost, and even surpass the expectations that you may have set for them. So families out there, come to us, let us do the assessment, let us give you the information that you need, but cooperate with us when we give you advice that outpatient may be good, inpatient may be good, and at the end of it, the results that you wish for your loved one will be realized if we work as a team, we the therapist and you the family. Thank you for today.